I rated the top 10 most popular supplements that claim to be healthy for the heart. That includes fatty 15. So let's get to it right away. Happy Thanksgiving, by the way. Also at the end, I'm gonna be reviewing any supplement you want me to review. You can put it on the chat. Um, and I start with YouTube members' questions or channel members' questions first. By the way, before we start, Dr. Brewer asked me to tell you. Remember, these are supplements; they don't replace a healthy lifestyle. So let's get to it. Fatty 15. You probably have heard of it. It's creating a lot of buzz, especially on the last 3, 4 weeks. I went through some of the papers. I listened to other people talking about it, specifically our friends Nick Norwitz and Brad Stanfield. We don't personally know him, but he talked about it as well. I went through the papers they showed, and I gotta say, even though I think the discovery of fatty 15, or specifically this odd chain fatty acid C15, it's really encouraging. To me, it was very impressive to identify that you can also find that on pecorino cheese or even in butter. Dr. Brewer likes to eat sauerkraut with pecorino cheese. I wonder if that's after the C15 buzz. It's not a cheap supplement. Dr. Brewer told me that. And the amounts of C15 that you need on your diet to basically put that into your system and have some healthy levels is actually very low. So that might make me wonder if you really need to supplement. Uh, just considering that, and basically that most of the papers that claim that the supplementation is healthy and that you need it and it can improve your metabolic markers is mostly funded by the company who's making the supplement, and other supplements, research is not showing necessarily the same results. Makes me wonder if you really need to supplement instead of having it on your diet. Uh, they will have to make more research. So, in my opinion, I'll probably will not spend my money on fatty 15. Not to say that C15 doesn't work, just saying you might not need to spend your money. Let me know in the chat if you think differently, if you have bought it and you are taking it and it's really helping you out. If that's the case, we can discuss. Next one, Enduracin. This is one of the preferred supplements Dr. Brewer uses all the time. This is niacin. And niacin has actually years of research behind it. It can decrease HDL. It can improve LDL if you're worried about it. It can slightly decrease triglycerides. And if you are a YouTube PrepMed channel member, you probably saw the video that Dr. Brewer and I dropped yesterday about other ways to decrease lipoprotein A, Lp(a), one of those hidden risk factors for heart disease. And you probably realize that we mentioned niacin as it can decrease somewhere closer to 12% to 20% Lp(a) if you're worried about that. The downside of niacin, of course, the flush. Some people will get that red hot face, and even on the head gets like that, and it can be very uncomfortable just because of the prostaglandins causing opening the vessels. It also can increase insulin resistance, not on the long term. This is just an effect that happens for a few days, not necessarily such a bad thing. But the one thing that I did not found with niacin, being very objective on it, it doesn't seem that in the long run decreases cardiovascular death. That's the thing with supplements. It's helpful, might not be necessarily there. So considering that, I'm rating Enduracin, putting that on the rank of A. Really good for specific biomarkers. It can be a good help for some things. Not necessarily is the game changer that we would love to see with niacin, and also just because it's one of those options that's really good for Lp(a). Next one, vitamin D3. Vitamin D3, and this is an interesting one. And this is the first time I'm putting a brand. Not necessarily, we're not sponsoring any of those brands. Wanted to say that up front. This I'm putting the life extension one just because it's the only one that I have seen that has 45 milligrams mg of vitamin K2. And for those who are not aware, Dr. Brewer recommends two. I'm sorry, I'm confusing vitamin D3 with K2. Vitamin D3, this one has 5,000 units. So most of the vitamin D3 bottles that you will see have around 1,000 units of vitamin D3, which to us is a little bit too low. We just don't throw vitamin D3 just because we like to measure levels first and after. So if your vitamin D levels is between something 50 to 90, that's good. That's when Dr. Brewer recommends vitamin D3. If that's not you, he doesn't recommend it. Why vitamin D3? Because there are plenty of studies showing that people who have lower levels below 50 nanograms of vitamin D3 on their blood have a higher cardiovascular risk. So that's why he recommends that. Downside from vitamin D supplementations, if you go overboard, it also can increase the likeliness of developing kidney stones, which can be very dangerous. So we try to, that's why we try to measure and make sure that you're not going too much on vitamin D3. Other than that, seems like a really good option. That alone hasn't also showed a decrease in cardiovascular deaths, like independently from other factors. And that's why I'm rating vitamin D3 as well, the number A. So considering that. Number 4, the GlyNAC. You probably heard about GlyNAC. We did a show about it before. It's a new supplement, glycine and N-acetylcysteine, that claims to reduce aging. It has shown to improve some biomarkers like insulin, fasting blood glucose, even a little bit on blood pressure. The research is not that, there's not that much research, but the research that is out there is actually pretty compelling. A couple of papers that are really well done, and they have a good case to say that GlyNAC is actually really good, specifically for people over 60 years old. For young people, not so much. And it's just because it's one of those potent antioxidants to decrease free radicals, decrease inflammation, and that's the way it works. The problem is research is not that much in there. We need more research on the supplement field. So that's why I'm putting GlyNAC on the B tier category. I was hesitant to put it on the B or even the C just because of the lack of evidence on it. So take that into account. Next one, CoQ10. This was a really revealing one because years ago, we thought CoQ10 was not there. It was theoretically on paper a good supplement to consider, just to be recommended only for people who were taking statins. I take a deep dive on what's new, and I was pleasantly surprised to see a couple of meta-analysis studies that were showing a lot of benefits on CoQ10, including decreasing Lp(a), including improving blood pressure, even some other cardiovascular biomarkers. So CoQ10 actually at higher doses doesn't seem to be much of a problem, and you actually need about 150 milligrams up to 300 milligrams a day to get some of the benefits. Is it the solution? No. But the evidence that I saw was stronger compared to other supplements. I don't know, I'll discuss with Dr. Brewer. I wasn't able to talk with him about this specific decision, but to me, just because it's a pretty much safe supplement, you don't need to be on statins to try it. It's kind of an S tier. And I'm not making any sponsorships for this specific brand. I just took this one because I think this one has like somewhere closer to 240 milligrams. I'm just saying just CoQ10 independently on the brand. And whenever we're talking about supplement brands, there is a lot of trusting. There's a leap of faith of thinking that they're doing the right thing and what they are selling actually has what they say they're selling. The regulations behind supplement industry compared to medication industry, very different. So not recommending any brand specifically, just saying there is evidence. CoQ10 supplementation has plenty of benefits, and I haven't seen any case of significant side effects. So I was very surprised, actually. I thought CoQ10 was going to score lower. Next one I have over here, I believe this is I'm sorry, I'm not putting I don't have my glasses on, and we are very stubborn on using this vertical live format, so I wasn't able to see that. Okay, so this is Berberine. Berberine is another one that's very, very popular. I cannot tell you how many dollars will I have if I got $1 for every comment that I see that Berberine is better than Metformin. I'll probably be a millionaire by now. But unfortunately, even though there is really good evidence, there is really good science saying Berberine can decrease blood glucose, can decrease insulin, it can improve multiple biomarkers. I don't think it's better than Metformin, and there are some studies comparing both effects. Actually, Berberine alone, it's more expensive than Metformin, but I understand that getting Metformin can be really expensive for some folks in the US just because you have to get a prescription for it, and the prescription might be even more expensive than the medication itself. That being said, Berberine has plenty of benefits, very low side effects, 500 milligrams once or twice a day, really good. So you might wanna consider that if Metformin is not on your budget. It's a good option, very safe, really good evidence. Doesn't seem to decrease mortality though, so consider that. Anyhow, Berberine, I will put it on the A list. And again, I'm not sponsoring any brand. I'm just saying Berberine. So if there's a brand of Berberine that you trust better compared to the one that I showed there, that's okay. So Berberine, really good. Now, vitamin K2, same life extension. And as I was saying, there are 2 doses that Dr. Brewer recommends for vitamin K2. Not so much for the idea of pulling plaque, pulling calcium out of the arteries. We have plenty of videos discussing why that's not necessarily the case. Most of the effect of vitamin K2 has to do with insulin resistance, which in turn will decrease the amount of plaque that you're building up. But there are 2 cases where vitamin K2 can help. The lowest dose Dr. Brewer recommends is 400 micrograms, and I don't think I have seen bottles that have 400. The most I have seen is probably somewhere closer to 200. So you might have to take 2 pills for the day, and that's for cardiovascular prevention. 400 micrograms mcg or more a day seems to be a good option. 45 milligrams has been studied for people with osteoporosis, risk of hip fractures. That's when you want a higher dose, and even that higher dose doesn't seem to be dangerous or have significant side effects. Vitamin K2 will not increase clotting. Clotting is something that you will see on vitamin K1, not so much on vitamin K2. It seems that vitamin K2, MK7, it's a little bit better than MK4. Not saying MK4 doesn't work. MK7 is a little bit better. The downside from the vitamin K2 research, though, is that there's not a strong meta-analysis showing overall mortality improvement. It helps on osteoporosis, but this is a list for cardiovascular health, heart health. So that's why I rated also vitamin K2 on the A tier. Very safe supplement. It can help, might not necessarily. Okay, next one. Omega-3s. So omega-3 fatty acids actually came into some backlash a few months ago because there's one study that said that people with atrial fibrillation, or people who are at risk of atrial fibrillation that are taking omega-3 fatty acids, can have an increased risk of episodes or atrial fibrillation events. But that same article said that even if somebody already has the diagnosis of atrial fibrillation, has less severity of symptoms and decreases cardiovascular death. So even with those caveats, and even with some research even saying that omega-3 fatty acids can increase the risk of bleeding, I haven't seen that many cases. I haven't seen that many papers that are strongly saying omega-3 causes bleeding or has significant side effects. I think it's a pretty much safer supplement, and pretty much everybody agrees that you need omega-3s on your diet. mostly EPA and DHA, that are the ones that you can get from fish oil or salmon oil. ALA might be helpful if you like flaxseed, if you like chia seeds. That's something that you might want to consider. Dr. Brewer did a good breakdown on the last Saturday video, top 5 foods that you need to eat, and a couple of those foods included a lot of omega-3s. So omega-3 supplementation, I think everybody agrees this is a good thing to do. So consider that. I'm just gonna highlight this. Carl discovered, you're not a member. I'm gonna say this. I did not hijack the channel. Dr. Brewer is enjoying the holiday, so I'm just a backup. But I really wanted to do something like this. Wanted to try something different, and I wanted to engage with you guys. I hope you're enjoying it, and if not, share it with your enemies or somebody you don't like, so they can waste their time and might be a side effect that they're gonna be healthier anyway. So consider that. Magnesium is another one. Magnesium is pretty much a really safe supplement. Any magnesium you take is pretty much safe. I know some of them can cause diarrhea. The 2 types of magnesium supplementation that Dr. Brewer recommends are magnesium glycinate and magnesium threonate. I'm not saying that oxide, citrate are not good. Those are good options as well. Just Dr. Brewer prefers those 2. It's hard to find a specific evidence when they compare glycinate to others. There are a couple of studies using oxide and citrate. Threonate really good for brain issues, insomnia, depression, anxiety, and also to replenish magnesium levels. And similar to vitamin D, most people are deficient in both vitamin D and magnesium. So that's the whole purpose, getting your serum levels of magnesium to a healthier range. That's why you like to supplement. That's where the benefit is. And I didn't find any meta-analysis. I didn't find any strong evidence that say, oh, people who are supplementing with magnesium are having a better prognosis, or living longer, or having less heart attacks. But also, taking too much magnesium is kind of rare, not so dangerous. That's why I'm putting it also on the A tier. Good option. We need it. If you want to supplement, go ahead. If you want to take it from your carnivore diet or some of other legumes or plants that have magnesium, go for it. The whole point is to have healthier levels of it. And magnesium, vitamin D, and calcium, all of them are pretty much related on the same metabolism pathways. So we do need them. Then another one, this is one of the preferred supplements from Dr. Brewer. Not this brand. He takes a powder, Nattokinase powder. I chose this one just to show about the dosing. Nattokinase, a few papers showing some good results, including plaque reversal on carotid plaques. The dose for the specific one study that showed that was about 10,800 fibrin units. Now, it's hard to find that. Most of the pills that you will get from Nattokinase have about 2,000 or 4,000 fibrin units at the most. This one has about 6,000 and something. So 2 pills of this, it's going to get you to something closer to 12,000 fibrin units, which is something more similar to what we saw on that paper. The downside is that's only one paper, not many people involved. There are other research. There's other research showing Nattokinase helps. There's only one about plaque reversal, but also seems to be a pretty much safe supplement. It does have the risk of bleeding, and that has been seen on people who are taking a bunch of stuff like anticoagulants, aspirin, maybe doing a little bit more of warfarin as an anticoagulant, and also Nattokinase or ginger and all other stuff, or are prone to have bleeding issues. So it's rare, but you can see that. And so just because of that, and because there's still more research to be done on Nattokinase, I'm putting that on the B tier. Not saying that it's not helpful. It's pretty much a safe option. I don't think it replaces some of the medication level things that we can use, but it's a good option. So if you have the money, if you want to spend on it, that's good. And that applies for any of these supplements. Like if you have an open wallet that you can just spend, these ones, most of them seem pretty much safe. Next one I put, and I'm putting this one just because there's a person. Let me see. I think I saw you, Gail. Gail, that is also wishing happy Thanksgiving to everyone. Gail put that yesterday. As soon as we uploaded that we were going to be talking about supplements, she said, oh, can you talk about IP6? So IP6 is a type of inositol, which is a sugar that is known to have plenty of anti-inflammatory properties. So I took the time. I went into Google Scholar and just take a look at a couple of the articles that I saw. There's a really good paper showing that IP6 supplementation can decrease blood pressure, but the level of blood pressure, the number on blood pressure that can get improvement from IP6 is pretty much low, 5 to 6 points. So I honestly didn't find any strong evidence for me to say IP6 is a good supplement to consider. It's safe though, doesn't seem to have so much issues. I didn't see any side effects that will tell us that that's a problem, and that's why I put it on the C tier. It could even go into the B tier. It seems that in people with diabetes might be helpful. So you will see that most of the problems with supplements is the lack of research. So we do need more research. And when you don't have research, you need to rely on the next level of evidence, which will be maybe case control studies, or maybe just experience from people, and or some lower levels of evidence like expert opinion, which I always tell Dr. Brewer this is not worth it. It's just because it's kind of the lowest level of scientific evidence. Anything below expert opinion, you need to take with a big grain of salt. So that's the list that I have. I'm pretty sure I'm missing a bunch of supplements. So what I want to do now is I'm going to go into the comments on the chat, and I have opened here a tab on my Google Scholar. So I'll be happy to walk you through some of the stuff that I do to do research and find papers and get some evidence on that. If that's something that you're interested in, hit on the chat. What supplement do you want us to review? I'm pretty sure I don't know all the supplements. And these ones are pretty much the ones that we see very often. And some of those are the ones that Dr. Brewer recommends, especially the ones on the A and S tier. So that's what I have. Let's go see some of the comments, or if you have some questions, let's address some questions. First of all, shout out to Rick, who just became a member. Thank you so much. That goes a long way. Let me see if I have some member questions, and then we can go to the next ones. And if you disagree with me, please tell me on the chat. You might be right. It will not be the first time I'm wrong. G. Fulton, today popular supplements for mental health are turkey, stuffing, potatoes, cranberries. Yeah, well, what's life without some of that, right? G. Fulton as well. Vitamin D, 50,000 units is routinely available in Saudi Arabia. My coworker was surprised he could only get 5,000 units in North America. Yeah, and actually, I have a patient. She's 83 years old. She only has one kidney. Her nephrologist recommended vitamin D, which I said, I agree. I was very surprised to see the nephrologist recommending 5,000 units a week. And the reason sometimes they do those high doses is because vitamin D is a liposoluble vitamin, meaning that it can get stored in the fat, but it's relying on the absorption, and the release of the vitamin D is going to be gradual. So I personally don't recommend those higher doses, especially if you're not measuring vitamin D levels, and especially in somebody who only has one kidney. But that's something that happens in Mexico as well. We do have some of those 5,000 units. I do take vitamin D because my levels were low, like most people. I don't go too much into the sun. I don't know if you can see it because the camera might blurry it, but mine is about, it got the focus. Mine is 5,000 units as well. Very cheap. Does it work? I'm going to be retesting my levels pretty much sooner. So good take. Take ADCR. Does Berberine have any coverage of olive leaf extract as an antivirus? No, we don't have. Olive leaf extract. You're skipping the oil and going directly to the leaf. No, we don't. We don't. I'm not aware of any research. That's a good thing, an interesting thing to review. I would like tell me if you would like to see one of these tier lists, and we ranking other than supplements. Maybe we can rank some um, natural remedies and stuff like that people really like. 273 watching, but only 64 likes. Yeah, what the H? Of course. Thank you. I think those are all the members. Oh, krill or fish oils. Fish oil, I don't have a preference. Um, let's use this one to do a small search on it. Let me show you what I do. This is just part of the process that I do. I do spend a couple of hours doing research for the channel. So what I do is I go to my Google Scholar and let's just type krill oil. And let's put cardiovascular health. Let's see what do we have. Clinical effectiveness of krill oil supplementation and cardiovascular health. I like these ones. And Google Scholar is really good on putting you some of what at least the algorithm thinks is the strongest evidence. So this is a meta-analysis of randomized controlled trials. Really good. Talking about the effectiveness in cardiovascular health about krill oil. This was published last year. Let's take a look. So krill oil, highlights of the article. Krill oil supplementation significantly lowered total cholesterol. We don't care too much about that. Low density lipoprotein cholesterol. We don't care too much about that. But triglycerides, this is good. Lower triglycerides usually means less inflammation. Krill oil supplementation did not significantly affect the blood pressure, blood glucose, and body composition. And you will see those mixed results with a lot of supplements. Krill oil where is it where or was? Well, I'm the worst on English grammar. Were well tolerated and generally safe, and no serious adverse events occurred during the follow-up. Good. So that's good. They included 14 trials, 1,400 participants. Not such a big sample for a meta-analysis. So these are small randomized controlled trials. Good quality evidence, low amount of people. So consider that as well. And the conclusions, the current evidence demonstrated that daily krill oil supplementation might as candidate for lipid management strategies in the future. Studies should pay attention to the relationship between krill oil and cardiovascular events and all-cause mortality. So there you have it. That's the kind of the frustration that you can get into whenever you're looking at scientific articles and you're like, it works, but it doesn't work for everything. That's part of the nuance. And it's pretty much because of the EPA and DHA. There is a specific medication level, omega-3 supplement, well, not supplement, medication called Vasipa, which is a very high dose of EPA and DHA, really good to decrease triglycerides. So pretty much the evidence fits. The other thing that I look at whenever I look at any of those research, I go directly here to the funding. This work was supported by Traditional Medicine Research Program or Guangdong Providence Undergrad, blah, 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 Medical Scientific Research Foundation of Guangdong Providence. This is a Chinese study. But it's good to know where the money is coming from because that's what you see with a lot of these supplements like Fatty 15. The study that showed that it can improve fatty liver was actually being sponsored by the makers of Fatty 15. So, and it's just like the phase 1, phase 2, phase 3 trials on medications. They're going to be funded by whoever is creating the medication, right? So that's on krill oil, at least one paper. We'll have to see a lot of papers. I usually don't decide on just one, but let's do now fish oil. Fish oil instead of krill oil. Rolling cardiovascular health. This looks like more a review. Let's see if we get an analysis or a randomized control trial or something a little bit better. If any. Systematic evaluation, recent advances 2 years ago. These all seem to be okay. Look at this: flaxseed oil versus fish oil. Will you be interested on that one? What's better, flaxseed or fish oil? Let's see on this specific article in people with type 2 diabetes. And you may say, well, there's these people with type 2 diabetes that doesn't fit my definition. I'm not diabetic. You might want to do a specific testing. Make sure that you are in fact not type 2 diabetic, or if you have insulin resistance or prediabetes, you might have the same risk. So in this one, this is a randomized, double-blinded, placebo-controlled trial. Everything looking good so far. They compared the effects of flaxseed and fish oil supplementation on cardiovascular risk. Randomly allocated 3 interventions groups: 1,000 omega-3 fatty acids from fish oil versus 1,000 milligrams of omega-3 fatty acids from flaxseed. Small study, but I mean, good quality, low amount of people, only 30. I'm sorry if you cannot see this too big. Let me make it a little bit bigger for you. There you go. For 12 weeks, they measure C-reactive protein, a very slight reduction of flaxseed compared to placebo. Flaxseed seed oil intake compared to placebo, significant increase in total antioxidant capacity, good statistic value. Overall, our study revealed the beneficial effects of flaxseed oil and fish oil supplementation on few metabolic profiles. This study suggests that the effect of flaxseed oil in reducing insulin and increasing total nitrate and total antioxidant capacity is similar to fish oil. So at least this study, it's saying that they work basically the same. Just one take of one study, take it as it is. Going back to the NLP question, I don't think there's so much difference between krill oil and fish oil, but if you like one more than the other, just make sure that you're getting those EPAs and DHAs. That will be my take. Let me see. Another member. Oh, Anthony Garcia. Happy Thanksgiving, Tony. Thank you so much. Oh, quercetin. I have reviewed quercetin before. The last time, if my memory works correctly, it wasn't that good. But let's do the exercise if you don't mind. Let's go ahead. So go back to Google Scholar. Let's put quercetin. Let's see what we find. So we have this. This seems like a review. There's no meta-analysis in there. So usually these reviews, what we'll do is they will find the small articles here and there, and they will tell you, oh, this is a study on rats. This is a study on a few humans. But it's not necessarily the structure of a meta-analysis, which is a little bit more robust or better, if you want to look at it that way. So right here, just by looking at this, it seems like it's all very theoretical. I'm not seeing a strong paper. Let's see if we put meta-analysis, and let's see if something pops up. Okay, there's one. Effect of quercetin on blood pressure. So this is for blood pressure. Let's see just blood pressure, not showing cardiovascular mortality, cardiovascular death. Journal of the American Heart Association. So let's see what they say. They included a bunch of articles. A meta-analysis show a statistically significant effect of quercetin supplementation in the reduction of blood pressure, possibly limited to or greater with dosages 500 milligrams a day. So they do need further studies. Let's see if I can see the funding. It should be right at the bottom. Who funded this? I didn't know that. So quercetin, at least one meta-analysis showing it can decrease blood pressure. Footnote, appendix, doesn't seem to be saying anything about conflict of interest. And it's not like the American Heart Association is free of conflict of interests in multiple circumstances. I will need to take a closer look. I will not bore you with all these charts. But interesting. So we're finding out quercetin might have some effects on blood pressure. See, there's another one. Effects of quercetin supplementation on lipid profile. Okay, let's see. Does quercetin improve blood lipids? 5 randomized controlled trials, 400 subjects. Available evidence from randomized controlled trials does not suggest any clinical relevant effect of quercetin supplementation on plasma lipids, apart from a significant reduction of triglycerides at doses above 50 milligrams. So, I mean, I don't mind if it doesn't increase HDL. I don't mind if it doesn't increase decrease total cholesterol or LDL, but if it helps triglycerides, that's interesting. How much did it go? 0.055 doesn't seem. Oh, right here. This is the one. On declining triglycerides, like 24 points decrease on triglycerides. Interesting. Yeah, I mean, and quercetin doesn't seem to have any side effects. So considering this, that it might decrease blood pressure, it might decrease triglycerides, I'll probably will put it on maybe on a C or B tier list. Interesting. I'm surprised. I honestly thought that quercetin was going to score lower. Really good comment, Tony. I hope that helps. Of course, we'll have to dive into more evidence. So just consider that this is just kind of a really over the top analysis that I usually do. I usually go over multiple studies. JD, Swapon CCCC, is this kind of a maybe typing error? See Dr. Ignaro for nitric oxide. We actually had Dr. Ignaro. So if you just go into the YouTube search tab and put Dr. Brewer, Dr. Ignaro, and then ignore the first 10 minutes, we were talking about accents and how I don't speak English very well. Ignore all of that, and then we go into nitric oxide. And we did have Dr. Ignaro, doctor who received the Nobel Prize in medicine for discovering nitric oxide. Three Lady, happy Thanksgiving. How do you ID safety and quality, different manufacturers or suppliers of subs? That's $1 million question. So you can do a dive on the internet, try to look here and there, and it's all about trusting. I do have a background in occupational medicine, so I have been involved and seen how they develop drugs in multiple pharmaceutical companies, and the processes on pharmaceutical medications, it's pretty much very strict, at least in Mexico. So you can tell they have a lot of quality audits and stuff like that. I'm not saying there's not corruption involved. There's of course money involved. That's just the way it is. I haven't been on a supplement manufacturing company or place, but I do know that if you look at some of the labels they put in these things, like, I don't know if this one has that quote. Maybe this one. I have multiple. I do take two omega-3s and vitamin D, and I also take metformin every other day or something like that. I know I've heard conversation about why are you taking that drug. I do take metformin. I have pre-diabetes, just if somebody is not aware of that. But some of these bottles will tell you this supplement is being processed in machines that also process soy or nuts or any other stuff, just because of the allergies problems. So that makes me think they're not having the exact process as medications do. And that's kind of the downside of the supplement industry. And I know, as far as I know, pretty much the big pharma has his hand on supplement industry. So it's not like they are completely separated, as far as I know. Take add DCR. I'm sorry, I should have done that as soon as you proposed olive leaf extract. Let's look for it. Let's do it. So let's look for olive oil leaf extract, and you want to see antiviral specifically. So let's see that. Olive leaf extract antiviral. See? So it's a pretty much popular thing people look for, right? Let's see a meta-analysis. Sometimes you need to do that. So there's a comprehensive review over here. You want to see COVID? Let's go here. Comprehensive review. Okay, so these comprehensive reviews are not meta-analysis. It seems that, okay, herbal compounds, but it doesn't necessarily might have olive leaf extract. So let's see, olive leaf extracts, comprehensive review. Let's see this one. Not the strongest evidence though, but it's maybe quoting some of the studies that are out there. 2024, which is good, very recent, last September. Pardon, this thing is a little bit slow. I'm gonna make it bigger for you. I know you might be seeing a bunch of letters. I'm trying to go just to the conclusions to see what they say over here, because it's not the strongest evidence. They're just seeing what's out there in the evidence, not necessarily doing some specific adjustments for statistics. So you need to consider that. Main conclusion of its overview is that olive leaves offer a myriad of therapeutic benefits, very fancy word, and that each cultivar can be regarded as a specific therapeutic target to address totally blah, 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 blah. Okay, so it might help a lot of stuff. See here. Hematologic disorders, including thrombotic issues. So it might work as an antiplatelet or anticoagulant. Decrease cholesterol and blood pressure. Regulate glucose. Maybe helps with other anti-cancer treatments. Improving neuroinflammation and anti-aging process. Antipathogen, which is the antiviral effect. And promoting healthy gut flora. So we'll have to see each and every one of those papers to see what's the weight on every one of those papers. I'm guessing a lot of those might be mechanistical, just on the lab or on rats, but it's a good thing that this is not funded by anyone. So I mean, just by looking at this paper, I know this is probably not the answer that you were looking for, TCAT DCR, but it seems that it might help. How much? I don't think it's going to be as good as a lot of antivirals out there. But interesting perspective. So, see, effective upper respiratory illness in high school athletes. This is a randomized control trial. Let's see. So for respiratory illnesses, which are mostly viral, first study to investigate. Let me make it bigger for you. First study to investigate incident duration in school athletes on respiratory diseases increases number of 6 days by 28%. So people, these high school athletes will recovering earlier. Reduction in number of days will likely aid in return to play and potentially improve performance. Very interesting. So really good results. It seems that it might be helpful if you're having this kind of colds or stuff like that. This research was funded by University of Auckland Food and Health Program Seeding Fund. Well, just with a grain of, not a grain of salt, a grain of seeds, right? There you go. So it seems that it might be helpful. I know the problem with a lot of these things is lack of research or strong research. Daniel P, is flaxseed oil due to a fiber? So if you're doing flaxseed oil, I don't think you're doing a lot of fiber. Flaxseed oil is much more because ALA, which is a type of omega-3. So ALA will be converted into EPA and DHA, and since the conversion rate can be very low, some study says 5%, something like that. Even though ALA alone can have some anti-inflammatory effects, it's the EPA and DHA which is the better. So you need a lot of ALA. Not saying flaxseed doesn't work. Actually, Dr. Brewer recommends flaxseed. He uses flaxseed powder, not oil, flaxseed powder on his salads. But it's just, you know, another thing that you can use to improve overall health as part of your lifestyle. G. Fulton, FYI, another way of getting a summary of krill oil is fish oil to type. What research is available comparing krill oil fish oil for cardiovascular health into an AI engine like a Grok X and ChatGPT? Yes, and I'm gonna look like the old person. I don't trust ChatGPT and AI that much just yet for that type of research. So, you know, whenever you do research on these type of search engines, you like to use some specific terms. So even if you go to PubMed, not necessarily Google Scholar, you want to do a term, then and, or, and the other term that you're looking for. And if you want to add something like the type of study or the year, you can do that. The AI engines, they might give you some specific on that and might get you quicker to one of two papers. I'm not sure they're necessarily the best papers. So still, I will spend the time. I'm sorry if I'm looking like an alt orange. Gold Scholar gives easier access to the rabbit hole, but not everyone wants to down the golden hole. Yes, exactly right. And that's why we try to offer this as the channel. Like if you don't want to go Google Scholar and you want to go AI, go for it. Absolutely. I 100% agree, G. Fulton. Just want you to have a glance of what I do whenever we do research for Dr. Brewer's videos. So it's not like we go to Wikipedia and just use that. Pity Hell, is berberine and bergamot the same? They're not the same. They're very similar and they have similar effects. But from the research I have seen, berberine is a little bit better than bergamot. That's my take. Anthony Garcia, I believe it's Dr. David Perlmutter who talks about it. I guess you're talking about taurine, maybe? Taurine for the electrical part of the heart. This is coming from Walter. I know our friend Nick Verhaven from Physionic has done some on taurine. I'll recommend you go look at that video. I think his most popular video is about taurine. So let's see taurine. Let's see taurine real quick. Taurine and CV help. Not saying mortality or morbidity. You can use mortality, so you can do that. Let's see a meta-analysis. And I know I do like meta-analysis. Some people will say, well, meta-analysis are only as good as the articles and the studies they include. I agree 100%. I do take a deeper dive in some cases for that, but this is just to show you what the process is. So good thing is there is a meta-analysis, systematic review and meta-analysis about taurine and cardiovascular benefits. So let's go real quick to the conclusion. Well, before the conclusions, 800 participants, 20 randomized controlled trials. That's good. Taurine supplementation significantly reduces heart rate, systolic blood pressure, diastolic blood pressure. The NIHA classification is a classification for heart failure, improving left ventricle ejection fraction. That is how much blood your heart actually pumps out. So it's better for people with heart failure. Really good results. It seems that taurine might help. And this is funded by a hospital. So unless the hospital has some ties with taurine industry, it seems like it's a good option. So at least this one study is showing some really good benefits of taurine, especially if you have heart failure. And I think that was the similar for one of these supplements that I forgot to mention. Really good for heart failure, CoQ10 as well. Really good for heart failure. That has been studied and decreases mortality in people with heart failure. That's for CoQ10. I forgot to mention that. And okay, Anthony Garcia, we also check labels to avoid supplemental made with seed oils. Yes, absolutely. We found supplements using olive oil, olive MCT and coconut oil. Okay, yeah. So that's the other thing. What are they using on those pills, right? Discrepancy between ChatGPT and Cleveland Clinic? Yes. Cleveland Clinic, as well as other big university and big hospitals like Harvard or I don't know, Yale, whatever hospital or university that you like to trust on. We have seen sometimes they don't have the same information they have on articles they have published by their professors compared to what they put on the website. So sometimes the website can be a problem. And I think I saw somewhere there are lawyers asking recommendations from ChatGPT, and whenever they get a case from ChatGPT talking about the specific thing, they go back to the reference that ChatGPT puts for them, and it's nowhere to be found. Like the references that ChatGPT uses to say something actually don't say anything of what ChatGPT brought up. That's what I'm saying. I don't trust AI that much just yet. What is the recommended therapeutic dosage from glycine NAC supplements? I don't remember. I should have. I think I wrote that down. Let's look for it. Let's see. I thought I saw a GlyNAC. We reviewed that study. We reviewed that study far back. Let's see. I think this is one of those studies. As I mentioned, GlyNAC doesn't have that much studies, so that's something to consider. So in this pilot, 36-week open label clinical trial, they used. Let me see if I can see how much they use methods. 4 weeks, 36 weeks, 71 participants. Study protocol. This is one of the major studies. This was conducted by Baylor College of Medicine. Well, okay, here it is. So specific dosing, see at this, they use 1.33 millimoles per kilogram per day of glycine, and then 0.18 millimoles kilogram per day of cysteine provided by N-acetylcysteine. So there you have it. Oh, one more thing that I found out today. We didn't even know that when we started researching for the GlyNAC. And just to consider, this is a funded study by them. They came up with the product, so they are gonna put whatever they think should be there. The thing is, guess who's the promoter of GlyNAC? Who's the company behind GlyNAC? And I know I put it on the tier because the results so far look good, but you need to know this: the makers of GlyNAC are at the very end of the conversation. It's Nestle, the food company. So consider that. ED, Mike, is not a strategy. I know, but you will see that it's hard to just say this works 100%, because even with things that work 99.9%, there's somewhere a place for error, and everybody's different. And some people will respond really good to a medication or to a supplement. Some people won't. And I like to use Mike just for you to make an informed decision, so you know. It might help, it might not. I would love to tell you and have the confidence, as a lot of people tell you, to say, oh, if you eat this, your life will change. If you eat this supplement, for sure your glucose is going to go down, and 100% sure your triglycerides are going to improve. That's not science. And that's the problem with the scientific community. It's hard for the scientific community to tell you 100% something's going to work. We are full of doubts because that's just the way it is. And I'd love to give you a more definitive answer for everything, but I honestly don't have it. I wanted to address a comment from JMK, just going back to LP-little-a. I agree. Please do not say that LP-little-a is a risk factor for atherosclerosis when there is zero cause and effect data to support such a statement. I mean, I agree. I mean, I think I have it too deep on my brain to say LP-little-a is a risk factor, because that's the way I was taught. So you can tell it's hard to unlearn. But it pretty much, if you have high LP-little-a, you need to look for your metabolic health to make sure that it's not showing some problem. Dr. Brewer likes to say it might be the firefighter. So if you have high LP-little-a, it means that you might have some inflammation going on, and that's kind of the problem. All right. So I'm not seeing any more comments or things on the chat. I'll let you go. Enjoy Thanksgiving. Thank you so much for bearing with me for about 50 minutes on the supplement list. Tell us in the comments if you would like us to cover any other supplements. Tell me in the comments if I'm wrong. I might be wrong. I'll be happy to look for more research on this. And next week, we have a very interesting interview with one of our patients who happens to be a lean mass hyperresponder. So don't miss that out. We'll discuss more on LDL cholesterol and stuff. So that being said, we'll see you next week.